Hello and welcome to yet another video by Pale Blue Thoughts. Today we have a special guest at our show. He's none other than Dr. Abby Phillips, a liver diseases specialist working at the Liver Institute, Rajagiri Hospital, Kochi. He has published several papers on the adverse link between herbal and other alternative medicines and severe liver injury, and is a strong opponent of AYUSH related healthcare systems which are not evidence-based. Today, he will speak on a very challenging issue that is notable among doctors and the general public during the ongoing COVID-19 pandemic. The medicines that are largely prescribed for COVID-19 patients by some doctors struck me as very odd. For example, many asymptomatic and mildly symptomatic patients are prescribed antibiotics, which are generally a group of drugs given to combat bacterial infections. Additionally, many doctors irrationally prescribe multivitamins, zinc tablets, and other dietary supplements. Today we shall discuss on the irrational prescriptions for COVID compared to proper evidence-based guidelines. We will also touch upon the possible reasons why some doctors prescribe illogically during the pandemic. To explain all this, we have TheLiverDoc, as he is known in the Twitter world. So without wasting any more time, let us go directly to Dr. Abby Phillips. Dr. Abby, what is your take on the common medicines which are prescribed for COVID? What do they really do, and are they really required?
So we have been seeing a lot of irrational prescriptions for management of mild, moderate and severe COVID in patients in this country. So an example that I saw was that recently I got a prescription from a patient of mine who was advised by a general physician when the patient tested positive for COVID and he was at home just with fever, a slight scratchy throat, and the prescription had like 9 drugs in it. Out of that, 2 were antibiotics, the rest were supplements, and some were gargles and some were cough syrups. Now just for a fever, he was prescribed 9 medications. So this is why this video is important, because we have to understand what is rational treatment of a patient versus an irrational treatment. And to actually understand what is rational treatment, you should understand what evidence-based medicine is. So let us start off with the first antibiotic, which everybody loves, and people just go on to a pharmacist, gets it from the pharmacist without a proper prescription and just starts popping it, and that is azithromycin. So initially during the COVID emergence about a couple of years back, there were some lab studies which actually showed that in the presence of azithromycin, virus replication, that is the growth of the virus inside a test tube or in the lab environment, actually comes down with azithromycin. Not only that, azithromycin had some effect on some of these immune cells known as neutrophils and the chemicals that they produce known as interleukins. So all that actually was controlled beneficially, leading to reduced viral load and viral replication in the lab setting. So if you find something in the lab setting, you have to actually test it in the human setting, right? So that is how we do studies. You have a foundational evidence, then you build on it, and then you go on to randomized clinical trials, and then ultimately a meta-analysis of these trials. So that is the highest evidence. So all of this was done in the last 2 years, and there were major 5 studies on azithromycin in the home setting, in the community setting, in the hospital setting, in the ICU setting. So many trials on this. So the most important ones are something known as the Atomic 2 trial, the Principle trial, the Coalition 2 trial, the Recovery trial, and the Action trial. So all of these trials actually showed that azithromycin is absolutely useless in COVID. Absolutely useless. So if you start azithromycin at the onset of fever or symptoms, if you start azithromycin once the patient is in the hospital, if you start azithromycin once the patient is inside the ICU, it doesn't make any difference. The only thing that happens is that azithromycin irrational use can actually lead to a lot of antibacterial resistance. So azithromycin is an antibiotic. It is given for a bacteria, and there are specific conditions where you give azithromycin. Number 1 is something known as to prevent exacerbations or worsening of asthma and chronic obstructive lung disease, so as to prevent pneumonia and something known as bronchiectasis, that is chronic damage to the lung and pus collection and repeated infections in patients with chronic lung disease. Long-term use of azithromycin is studied well and is actually recommended. But what we are dealing here with is a virus, and a virus cannot be killed nor controlled with something known as an antibiotic, which is an antibacterial, which works against bacteria. This is common sense. So I've seen these general practitioners, including pulmonologists, specialists, prescribing irrationally azithromycin for 3 days, 5 days, 1 week, 2 weeks, and people coming in with azithromycin induced liver injury. Yes, this is also reality. Unnecessary use of azithromycin in patients who are at risk of developing liver injury can lead to severe cholestatic injury. Cholestatic injury means the patient develops a liver injury, the bile inside the liver gets collected, it does not come out because of the liver injury, and patients get jaundice with severe itching. Now, I've had patients who were itching so much that they were contemplating suicide because they could not sleep for many weeks together because of azithromycin liver injury. Just imagine, unnecessary. So there is no role of azithromycin in the management of COVID-19. Whatever people say, there are a lot of people who would keep coming and giving you lame excuses and lab related data to show azithromycin has some properties. Yes, in the lab, in the mouse, in the cell it has, but inside a human being with COVID-19, azithromycin is as good as water. Actually, water is safer, so you can have that. So this is what we have to know about azithromycin in COVID-19. Okay, so now we have very strong evidence that azithromycin does not work in COVID. This evidence was strengthened actually with a beautiful meta-analysis that came in the Journal of Antimicrobials and Chemotherapy, published by Oxford, where the authors looked at every possible good quality randomized controlled trials on azithromycin in COVID. And this was actually authored by this professor known as Louis Airbe. You can actually find it on PubMed. We'll post the links also here. And he found out that looking at all the major studies, about 16 of them, azithromycin definitely has no role in the management of COVID in the inpatient or outpatient setting or at home. So that was done and dusted. Now, because azithromycin was thrown out of the window, people started looking at other antibiotics. So came in doxycycline. So doxycycline is actually something known as a tetracycline. That is a group of drug. And it has specific uses. For example, in leptospirosis, something known as rat fever. That we actually use that in cases of leptospirosis outbreak, doxycycline. It's very, very useful. It is recommended. It is studied for that. Now, when they looked at doxycycline, they saw that doxycycline also has same properties like azithromycin. Yeah, you know, it kills virus in the cell, in the test tube, in the animal, whatever. And so this principal trial actually looked at usefulness of doxycycline with azithromycin and without azithromycin in patients with COVID in the hospital or out of the hospital setting. And not surprisingly, they found out that even doxycycline was useless. Right. So prescribing doxycycline with or without azithromycin for a COVID patient who has just only fever without any evidence of bacterial infection is actually quite nonsense. And a lot of dental practitioners, specialists are actually doing this. And a lot of patients are also doing this without proper prescriptions. They are just going to a pharmacist and buying this stuff and just, swallowing it. And you know what this has actually led to? So there was this paper in Indian Journal of Gastroenterology regarding something known as pill esophagitis. And doxycycline is actually one of the commonest causes for that. So doxycycline is a small pill which has to be taken in a sitting position with large amounts of water. Otherwise, what happens is that it gets stuck in the esophagus, in the food pipe, and it stays there, causes severe ulceration. And at some point, it becomes severe that patients are not even able to swallow water. So that is known as pill esophagitis. So there is now a big outbreak of pill esophagitis in India because of unnecessary doxycycline use. And this is because of unnecessary prescriptions for a drug which actually does not even work for COVID. Now you have a disease to handle, you have a pandemic to handle, and you are causing smaller epidemics in it. You know, without the use of doxycycline, you don't have to deal with pill esophagitis. And this is what is happening. People are creating more problems within a problem. And this is because doctors and physicians and scientists and whoever is prescribing these medicines or treating patients in the front line do not realize the importance of reading Evidence-based medicine, it's right there in front of you. See, a layman cannot read that and understand as much as a doctor or a scientist can. So it is your responsibility to read that, understand what the updated guidelines, recommendations, study results, and then tell the people and the public about it, instead of just keeping on writing 9 to 10 drugs and making money out of it. So this COVID time is actually a good time for small clinics and small physicians sitting in clinics to make a lot of money, because they can just keep prescribing things and people will take it because they are scared. There is no need to be scared if you are vaccinated. Vaccination saves lives, and that is what is most important, and not all these unnecessary medicines like doxycycline and azithromycin. Okay, so apart from antibiotics, I think the next best pet drug for COVID for a lot of practicing physicians and patients of COVID are basically, I think, vitamin D and vitamin C. So let us talk about vitamin D first. So what is the role of vitamin D in treatment of COVID-19? Nothing. Absolutely no role. So if a patient was vitamin D deficient and you gave vitamin D to that patient, I mean patient of COVID, versus a patient who is vitamin D sufficient, for example, he has no deficiency of vitamin D and has COVID, the outcomes of both these patients are the same. Even if you give the patient with vitamin D insufficiency or deficiency, give them more vitamin D, it does not change the clinical outcome. So this was studied in a large group of patients in Brazil and published in JAMA in 2021, I think February last year. And they found out that supplementation of vitamin D, even in patients with vitamin D deficiency, did not improve clinical outcomes. Now, if somebody is vitamin D deficient, definitely yes, go for vitamin D supplementation, but do not consider that as a treatment for COVID, because it doesn't matter anymore. Now, very interestingly, latest news, that is, I think about 4 days back, it was published in the Lancet Diabetes and Endocrinology journal, where a group of researchers did a study spanning 5 years. And in this 5 years, what they did was they gave vitamin D supplementation to elderly people who are very deficient, and then followed them up. And very interestingly, they found out that after they corrected for vitamin D deficiency in this group of patients over 5 years, there was about 20,000 patients enrolled. That is like the highest gold standard of RCT, 20,000 patient study. They found out that vitamin D supplementation did not improve anything. But in a small group of patients, it actually led to increasing cancers. So we should be very careful what we are supplementing in the long term. So there are a lot of people who keep on taking vitamin D without knowing the vitamin D status, or just, it's like a daily routine for them to pop a vitamin D pill or weekly vitamin D pill. So that needs to stop, because that can actually promote certain cancers, as was shown in this study. Not only that, if you look at all-cause deaths due to various diseases, for example, immune-related diseases, heart diseases, lung diseases, brain diseases, vitamin D supplementation did not improve any of these outcomes. Vitamin D supplementation did not reduce any of these disease burden. So this is very important. So please stop going behind vitamin D as if it is some holy grail. It is not. And just popping vitamin D pills in the long term may actually harm you. So this is what doctors should know, and doctors should tell patients, and patients should know, so that they don't go and do this to themselves. So vitamin D has absolutely no role in COVID, and it is not recommended. If you are deficient, take vitamin D, supplement it, come to a recommended level that is above 30, and then stop it. And that is all that you could do, you need to do for vitamin D in COVID. So we come to the next important supplement, that is zinc and vitamin C. So to start off with vitamin C, so you have all these prescriptions, right? For COVID patients, there is a gas medication, a proton pump inhibitor, then you have vitamin C, then you have zinc. You can actually get combinations of this now. I mean, that is how pharma companies make money. They make kits. So there is vitamin C, vitamin D and zinc in it. I think it's called ZAC-D or something by some weird company. And that is what has been prescribed. So you have vitamin C, vitamin D and zinc, everything in a pill, and you think it is going to help you. So vitamin D does not help, we know that. Vitamin C also does not help, because there are multiple studies done on vitamin C supplementation in mild COVID and critical COVID. in the form of tablets, in the form of injectables, and the researchers found out that absolutely no value in improving clinical outcomes. It did not reduce death, it did not reduce symptoms, neither it did any good for the patients in hospital. So vitamin C is absolute bogus when it comes to treatment in COVID-19, so please don't prescribe it. It's unnecessary. You just need vitamin C as per your dietary allowance. Now coming to zinc. So even zinc actually has shown some antiviral properties in test tubes and cell studies, and that is why people just keep writing it, right, left and center. And I know patients who are taking zinc since last 2 years because of COVID. They have never stopped it, which is very dangerous. I'll tell you why. Because if you take zinc, the doses that is required for zinc, elemental zinc, is actually 11 milligrams daily in men and 8 milligrams for a non-pregnant woman. That's it. And you get that in your diet. You don't need to take it from anywhere else. All your diet is sufficient in it. And what happens if you actually supplement zinc in the long term? So what happens is that when you take so much of zinc, your copper levels start reducing. So zinc actually binds copper, and copper gets excreted in the stool, and you will have copper deficiency. So once your copper levels start falling, because copper is also important for your daily physiological activities in the body, in the cells. And once copper starts falling, you start getting a lot of problems starting from the brain to the blood. So you have neurological problems, irritability, low concentration. In the blood, you will have low white blood cell count, low platelet, and lot of stuff, lot of problems with copper. So copper deficiency can happen with long-term zinc use. So all of those who are actually seeing this video and has been taking zinc for a long time, please stop it. Throw those tablets out of the window, because zinc is not going to help you in COVID. Neither it will prevent COVID, nor it will treat COVID, nor it will reduce COVID burden, nor it will reduce death, nor it will reduce your chances of going to a hospital. So please stop zinc. Vitamin C, vitamin D, absolutely useless. Same to do with all the multivitamins that you're popping like gems and candies every day. Please stop that, because none of that actually works for COVID. None of that will actually protect you from COVID. So now we come to the most difficult part of this conversation. It's on this drug, miracle magic pill, which actually is a dewormer, good for killing parasites and worms. But for some reason, the world has gone crazy over it, thinking it's a COVID miracle drug. It's ivermectin. So ivermectin, the tale started off way back when a small study showed that ivermectin reduces virus replication, just like our azithromycin and doxycycline story. It also reduces viral replication inside the test tube in cells. And then people just started using it right, left and center. A lot of professors, scientists, heads of state, authorities, they all started talking about it. Like ivermectin was actually the miracle drug. And unfortunately, it just went out of hand, snowballed. And you have a lot of studies on ivermectin showing that ivermectin is A-okay. It's the best drug in COVID. And a lot of groups, for example, there is a group called FLCC, there is a BIRD group, and there are multiple groups like who support ivermectin. They came up, and they're actually all run by doctors with proper medical degrees, working in the critical care units, working in intensive units, working in pulmonology units. I mean, they are credible people talking nonsense. So you actually don't know that they are talking nonsense because they are credible people. You are looking at them, but you are not looking at what they are saying, because if you look at what they are saying, everything is absolute rubbish regarding ivermectin. So ivermectin studies, a lot of studies came, a lot of meta-analysis of these studies came, which are available on all of these websites which these guys run. I call them the Iver cult. They are basically cultist groups which promote a kind of dissonance between government policies and actual policies, and they just want to stand out and get the attention. And a lot of them are actually, they ask for donations on their website so they can get money out of it. So they're grifters. So they basically do this not for the benefit of the patient, because there is no benefit of ivermectin in any study, actual proper study done. They are going to benefit themselves. So they are going to make money out of your low intelligence, and that is what is happening. And they are actually very intelligent. They know that. And what happened was that a lot of people started using ivermectin, and poor horses in the United States started getting less of deworming drug, and they started getting more of worms because humans were eating all their ivermectin stuff, pills and paste and whatever, and ultimately something bad has to happen. So it did. So this paper came out in NEJM, New England Journal of Medicine, where they actually showed that people consuming ivermectin over the counter, including horse dewormer paste, developed severe ivermectin induced side effects and had to be hospitalized. So there were like 23 cases reported in that. And so high dose ivermectin not only causes harm, it does not do anything to COVID virus. So this should be known. So there are, even now in India, in Uttar Pradesh and Bihar, and to some extent in the south and in other states, Goa and all that, people were actually prescribing. The government policies was actually to prescribe ivermectin as part of a kit, which is absolute nonsense. And I think it has been chucked out of the window by most of the state governments, but there are governments which still give ivermectin kits to people who are having COVID for home management, which is absolutely nonsense. So I think the only good thing that has happened in this is that a lot of people who actually had silent worms actually got dewormed in the process, and which is actually good. But there is a role of ivermectin in COVID, and that is to make money. So the FLCC and the Bird Group organizations and all those ivermectin cultists who talk about anti-vax propaganda and all that, they are the ones who are going to benefit from it, not you, not the ones with COVID, not the patients. They are not going to benefit. These people are going to benefit. So that is one use of ivermectin. The second use of ivermectin is that if somebody has worms and they don't know about it, they actually can get cured. That's a good thing. So if somebody has worms with COVID, please go for ivermectin. Otherwise, please use ivermectin so as to give money to all these grifter organizations who are waiting to latch on to your money. And that is the role of ivermectin in COVID. So nobody prescribes or recommends ivermectin anymore in COVID, including a very recent study published just this month in International Journal of Antimicrobial Agents, where they even used a high dose of ivermectin in a randomized double-blind trial, and this was done by a person known as Dora Bonfrate, and she is the principal author, the investigator, and she actually, the group actually found out that even high dose ivermectin does nothing to COVID. So please don't go and buy anti-worm drugs in COVID times and make yourself look like a fool. That is what I have to suggest, and please tell others also not to do it, so that even they don't have to look like fools in front of you. This is specially for people from India who are dealing with COVID, where we have something known as AYUSH, right? So if you look at 2 years back, so AYUSH brought out guidelines for preventing and treating COVID through ancient wisdom and also nonsense wisdom, which is homeopathy. Ancient wisdom is Ayurveda, nonsense wisdom is homeopathy. And what they did was, in the last 1 month, they actually revised these guidelines based on new data, right? So they do research. AYUSH does research. Ayurveda, yoga, Unani, naturopathy and homeopathy. They do research, so they revise their guidelines. So if you go and look at all the guidelines during the start of COVID versus all the guidelines, that is revised guidelines now, in the role of AYUSH in treatment of COVID, you will see that nothing has changed. Everything is the same. So initially they said drink Giloy juice, inhale tulsi and whatnot, have some pepper and turmeric, put it in some milk and water and mix it and make it into some potion, drink it and gargle it and stuff like that. And of course, while doing all that, you have to do yoga, and in different positions the virus will not be able to attack you. So if you are in a position like that, the virus has to come like this, then you go into a position like that and the virus has to come like that. So it's difficult for the virus to infect you if you are doing a yoga. That is what ancient wisdom says. But in reality, if you look at the last 2 years, absolutely zero publications in the clinical aspect on AYUSH has been done in COVID. The small pilot trials, unnecessary trials wasting taxpayers' money has been published, and even that actually shows nothing major. A lot of the data is fully faked, fraudulent data. you can actually go and read about it. Most of them are run by private Ayurveda companies only, and it doesn't make any sense. So coming to homeopathy, so they initially said that arsenicum album 30 is the drug which will prevent COVID, which is actually as good as the vaccine. And people started taking this sugar pill right, left and center. Even the Kerala government gave it to the kids. Have this candy which has magic potential, so all the kids also had it. And it's free. Anything free, I don't think it's very valuable if you're just giving it like that. So what happened was that everybody took all these homeopathic pills, and then suddenly in between there is a study. Homeopaths know how to run a trial better than Ayurveds. I give it to them. So they did a randomized double-blind placebo trial on, I don't know why they did a placebo in homeopathy, because most of the homeopathy is placebo, but still they did it. We have to give them credit for that. So they did a placebo-controlled trial on arsenicum album, and actually they published that in a journal called Homeopathy, which is the only impact factor journal for homeopathy. Nothing else, there are no other journals on it. And in that journal, these authors actually say that arsenicum album 30 did not do anything for COVID. Basically, did not prevent COVID. Everybody got COVID after even having that, and it was absolutely useless. It was like a placebo. So this came out last September, and the revised AYUSH guidelines came now in January 2022, and they still mention that we should give arsenicum album 30C. So probably they have no idea about what all have been happening in the field of AYUSH, and they just copy pasted the old guidelines to the new guidelines, and saying that it is backed by research. It is backed by nothing. It is backed by a lot of wastage of taxpayers' money. That is what it is backed by. And very importantly, now we have data that giloy juice not only it does not prevent COVID, but it can actually harm the liver. Yeah, so we have that data. So everybody who is actually an AYUSH user are by themselves giving consent to become a guinea pig during the pandemic, which is good for researchers because they have a lot of data. And if you want to become a data, please go on and follow whatever is AYUSH saying. If you don't want to become data or a guinea pig, please don't do that, because that is the most sensible thing to do. So ultimately, giloy induced liver injury, a large series was published from multiple hospitals in India, where actually they showed that giloy can actually harm the liver because it has got immune modulating potential for the bad. It is not beneficial. It actually kills the liver. About 10% of patients in that particular study underwent a liver transplantation. Just imagine, they took giloy to prevent COVID and ended up with a new liver. I don't think that's a good thing. So please don't go for these untested herbal medicines. Whatever they say, whatever traditions say, whatever the old texts say, it doesn't make a difference. If it is not evidenced, it doesn't exist. So please follow real rules of treatments from real doctors based on real evidence. Oh guys, before I end, there is one more thing that I would like to say. When I said AYUSH, I missed something. I missed the S, which is Siddha, which is actually even worse because it's full of heavy metals. And Siddhas give something known as Kabasura Kudineer to prevent COVID. Cops in Tamil Nadu were actually serving Kabasura Kudineer drinks to pedestrians on the roads to prevent COVID. Right, so this happened last year, and after all that, everybody got COVID. And the ones who did not get COVID, or the ones who did not get severe COVID, were the ones who were vaccinated actually. And that was actually not discussed on a public forum or to the public by these cops who are actually giving these drinks. So Kabasura Kudineer is actually a herbal drink or a herbo mineral drink, which people think has some magic powers in preventing COVID. And how did they find that out? So the Siddha researchers, they actually did a research on it, and they actually put this research on placards and blackboards, and they show each other and the community as a whole to actually mislead them, because that research was not even done on humans. It was done on a computer. It was a computational analysis, in silico analysis in the lab. There were not even cells out there, and they did it on a computer, and that computer told them that yeah, maybe this thing could work. That's it. So they actually took the computer's advice very seriously and started giving this Kabasura Kudineer to everybody on the streets, and it did not help. and it did help the patients who were actually asymptomatic, sitting at home and watching TV and Netflix and all, who are COVID positive, no symptoms at all. The ones who took cabazitacodenir at that time, they became okay. But the ones who were actually ill, taking cabazitacodenir actually did nothing to them. So if you have COVID and you are healthy enough to watch TV or play a match of cricket, taking cabazitacodenir can help you. And that is the only role of cabazitacodenir. Otherwise, absolutely no role of even Siddha in management of COVID. So please remember that. So to end, azithromycin, doxycycline, vitamin C, vitamin D, zinc, deworming drug, ivermectin, any multivitamin supplement, any herbal drug, any herbal supplement, any tulasi inhalation, cabazitacodenir, homeopathy, yoga, none of these help in managing, preventing or treating COVID. That's the bottom line. Thank you.
Wow, thanks a lot, Dr. Abhi. That was really informative and eye-opening. So, you have heard what Dr. Abhi had to tell us. These medicines play no role in treatment or management of COVID. Of course, people often have to be blamed apart from the modern medicine doctors who prescribe this. I have heard this from many people who say that if a doctor doesn't give me at least 3 to 4 medicines, then they feel that the visit to the doctor is a waste of time and they question the competency of the doctors themselves. So the doctors may be pressurized to give out these medicines to satisfy the confirmation bias of such people. However, it sends out a wrong signal and also can lead to a situation of antibiotic resistance and damage caused to our good gut bacteria, which are useful to us. Dr. Abhi is a strong opponent of AYUSH related healthcare systems, which people call as complementary and alternate medicines, and what I call as woo-woo medicines. He publishes a lot of valuable information, including published studies and real life experiences of his patients where people have suffered sometimes irreversible damage to their livers by consuming these alternate healing therapies. I request you to please follow his Twitter account at TheLiverDoc, where he uses dark comedy to bring the actual reality of these woo-woo systems to light. Trust me, it is highly informative and his replies are always laced with sarcasm that you would roll on the floor laughing. I hope you enjoyed today's episode and found it informative. Please share this video with your friends and family if you found it interesting. I once again wish to thank Dr. Abhi for his insightful session and for taking out his valuable time to come and speak to us. I will be back soon with yet another interesting episode. Until then, it's bye-bye from Pale Blue Thoughts.